Hi there, it's Dr. Jim Collins. Thank you so much for taking some time. I do have an important topic and a sad, darker topic related to COVID-19. Lately, I've been looking into mental health and substance abuse issues that are being exacerbated and made worse by this viral outbreak. And I'm reading a lot now about opioid addiction because we already have. This is a pre-existing national health problem. But staying at home, self-isolating, self-quarantining, that's what we're doing. These are all necessary to reduce the spread of the new coronavirus. Unfortunately, being isolated from others is dangerous to some individuals who are fighting their addiction currently, right now, to opioids, or they're in recovery. Experts say that addiction is a disease of isolation, and cutting them off from groups and therapists, counselors, and others may be putting them at an increased risk of relapse and maybe even worse. Online help is there. Telephone, you could pick it up. I get it. While many addiction groups are moving online to provide support, some individuals report feeling isolated and alone. Phone meetings aren't the same as seeing people face to face as they work through their problems together. The point of going to a meeting is to be with people, to be social, and to feel connected, to hear voices and see faces and share stories. Some experts believe that the corona epidemic will make it more difficult to stay in recovery and to stay healthy in general. There's a whole new set of triggers out there. And most of us who are not in mental health, we wouldn't think about these things, right? That's why I'm bringing this information to you. And I hope you forward this video and my content on. Give it away. Give it to everybody you can. Because there's a whole new set of triggers out there. While it's safer to stay home during the outbreak, some individuals will experience very tough emotions and feelings like depression, anxiety, hopelessness, helplessness, especially those individuals in recovery. And it's feelings like these that are directly associated with the urge to self-medicate and to use substances. And to make matters even worse, the pandemic is creating a whole new set of triggers. From images of death on television to climbing infection statistics online, all we have to do is click and find triggers. What about methadone clinics? That was one of my questions. Recently, the federal government changed some of its rules concerning methadone dispensing. Individuals no longer need to get their medication every day as they were doing in the past, but instead, they are receiving between a 14 to 28-day supply so that they can reduce their visits, reduce contact, and reduce exposure. Smart, right? This seems to be a convenient solution, but there is an associated problem with it. Lots of experts worry that people will take that supply, overuse it, mix it with other drugs, or sell it during these tough economic times. There are fatal outcomes to be concerned with, and that's why I want you to share this information. Coronavirus has created a new set of problems for people in recovery and those actively addicted. They're alone. They're struggling not to use amongst multiple stressors. They may be taking larger amounts of opioids than they did prior to the outbreak, and they are at an increased risk for fatal overdose. Some experts worry that there will be an increase in the amount of opioid-related deaths during this pandemic. And treatment options appear to be somewhat limited right now. Another serious concern is that many people with a history of drug or alcohol use may actually be more susceptible to COVID-19 because of their weakened immune system. So many things that I didn't even think about. They may also have pre-existing conditions like multiple infections, HIV, hepatitis C, for instance. Many may smoke, and they may be heavy smokers, have a long history of smoking, making their lungs even more vulnerable to the virus. This all puts them at an increased risk for severe respiratory complications if they do become infected. So, my final thoughts on this topic, it's a heavy one, but thanks for listening. I appreciate it. There is widespread concern among experts in substance use that people, and perhaps many of them, will become infected with the coronavirus and develop the illness, COVID-19. The infection then could spread rapidly through whole communities of drug users. Some people will not stay at home. They will go out and seek drugs to self-medicate their feelings and their emotions. Others will continue to sell drugs to vulnerable people who are resisting taking them or who are in recovery. The outcome for users and those in recovery looks fairly grim at the moment. But that's why I'm presenting this information to you, because there's so many things that we can do. If you know someone in your family who is struggling, if you have a friend who is struggling, if you're a mental health or a healthcare provider and you're out there, we all can lend a hand. We can all ask, how are you doing? We can call people. We could check up on them. We can email them. I know it's tough. I know you're in recovery. Talk to me about your feelings. Talk to me about how you're doing. Are you using? These are hard conversations, I know. But I really believe that there's no room for error right now. We have to have courageous conversations because we might be able to help someone or even save their life. Thank you for listening. I'm Dr. Jim. Keep coming back for more information.